Okay, so now we look at the intervention in delaying the progression of chronic kidney disease. So number 4, the aim is to delay the progression, reduce risk of cardiovascular disease, as well as to manage the chronic kidney disease complication. So the main strategy here is the optimal blood pressure and blood glucose control, and also the use of renin-angiotensin system blockers in proteinuria chronic kidney disease. So these two is the main strategy. Whilst we look at below, we have additional measures, which are the first one, lifestyle modifications, and also the second one, avoidance of potentially nephrotoxic agent. Okay, let's move on. The first one under point 4 is 4.1 treatment of hypertension and proteinuria for renal protection. So intervention is where we control the hypertension and proteinuria, which can help in delay renal disease progression. Okay, so the first line therapy, what we prescribe is the ACE inhibitor and also the ARB. Okay, and these have the additional renal protection effects. So we will consider both of these drugs because as the first line therapy because it has the additional renal protective effect other than a bit more than the other drugs. Okay, so these drugs are preferred in non-diabetics and also hypertensive chronic kidney disease patients with proteinuria. So they have the condition proteinuria and also hypertensive and also chronic kidney disease, and also they are non-diabetics. So here the recent data demonstrate that lowering systolic BP towards 120 mm mercury confers some cardiovascular benefits in non-diabetics kidney disease patients with high cardiovascular risk. So this is what we have to do, and the red color indicates the caution or things that we have to avoid, which is we have to be cautioned. Especially the physicians have to be cautioned on the adverse effects. Okay, where example is the symptomatic hypotension and also acute kidney injuries. So move on to the next one is about the glycemic control for renal protection. So glycemic control is also very important where we have to lower HbA1c to approximately 6.5% to 7%. This can help to reduce the development of micro and macroalbuminuria. Okay, so but we have to be careful also because here is stated that the aggressive glycemic control, aggressive one, will lead to increase the risk of hypoglycemia and death. So here is that to conclude is that we have to control the glucose level, but it's not in an aggressive way. Okay, so move on to the third one, protein restriction for renal protection. Here is about protein. So we have two. This one, the protein diet recommended is the first one for the diabetic kidney disease is 0.8 gram per kg per day, while for the non-diabetics is 0.6 until 0.8 gram per kg per day. So why it's not advised for the diabetes kidney disease to have a low protein diet is because we're afraid that there is risk of malnutrition. And move on to the next one is the lipid lowering for renal protection. There is insufficient evidence to support this. the use of statin therapies. And for the uric reductions, also there is emerging some evidence such as uric acid reduction is potential strategy to delay chronic kidney disease. However, so they also require more clinical study and need to confirm whether this is it really that reduction of uric acid can help in renal protection. So the sixth one is about miscellaneous agents for renal protections. There is study about these two, the phentoxyphylline and also vitamins. But there is also no conclusive evidence. There is study, but no conclusive evidence. So the seven is the special precautions. Review all prescribed medicines regularly. Yeah, for sure. When we are dealing with the kidney disease patient, especially the chronic kidney disease patient, we have to always review the prescribed medications regularly. Why is to ensure those appropriate to the current renal function, and we can have any adjustment if there is a changing of the situation of other conditions occur. And we have to remember avoid NSAIDs, non-steroidal anti-inflammatory drugs, includes the cyclooxygenase 2 inhibitors, and also avoid long-term uh, PPI use. Proton pump inhibitors.